Okay, so if we had to sum this up in about 30 seconds, we would say stiff person syndrome is an autoimmune disorder affecting GABA synthesis. Of course, we're going to go a little bit deeper, so we're going to talk about the pathology first. So the primary pathology is that we are inhibiting our glutamic acid decarboxylase via autoimmune attacks in the central nervous system. This is going to prevent the formation of the neurotransmitter GABA. And then when we decrease our level of GABA, we're going to have nervous hyperactivity. So the main symptoms of stiff person syndrome are difficult movement, muscle spasms and stiffness, myalgias, which are muscle pain, stiff posture, hyperlordosis, which is excessive curvature of the spine, and shortness of breath. For the biochemistry, the key ingredient to GABA synthesis is glutamate. So, as we know, glutamate is responsible for things like the sleep and wake cycle, stress responses, memory and cognition. It's a very important neurotransmitter. So, the glutamate decarboxylase enzyme is going to form GABA. And so, we'll take the L-glutamate with the use of a PLP active site. And through there, it'll use a shift-based linkage to remove the carboxylic acid group. It's very similar reaction to our transamination reactions we see with amino acids, where we are using lysine to take off the amine group and form our GABA, but in this case, we're removing the carboxylic acid instead of the amine. So the role of GABA is to inhibit the nervous signals inside of the brain and the neurons. So the GABA will enter the synapse. From there, it'll bind, and once it binds, it's going to hyperpolarize the neuron. And then from there, the neuron's not going to be able to fire the action potential that it needs to. And then eventually, when the GABA is gone, the GABA transaminase will form the metabolic byproduct, and then that will then go through the Krebs cycle to be metabolized into energy. And then we have a diagram off to the right here where you can see kind of the life cycle of the GABA molecule and where things go as it's used and how it's made, things like that. We do have some interesting pathology that is not related to stiff person syndrome, but is also linked with hypoexpression of the GAD enzyme. Some of the interesting ones that we found were autism, diabetes, schizophrenia, Parkinson's syndrome, and neuropathic pain, which is the pain from the nerves. While we don't know specifically how the diseases are occurring, we can tell that the proper production of GABA is critical to maintaining homeostasis in the body.
All right, and now we're going to talk about incidence and prevalence of stiff person syndrome. So this is just a very rare neurological disease. It only affects like about 1 to 2 people per million, and it often develops in people that are ages 40 to 50 or 60. And it was first named in 1956 as stiff man syndrome, but then that was then changed to stiff person syndrome. It's considered a spectrum of disorders just because there's a varying level of severity for different symptoms as far as muscle spasms, muscle pain, muscle stiffness, that kind of stuff. And to tie in directly with that, there's different types of stiff person syndrome. So you've got your classic stiff person, which can be stiffness, muscle pain kind of anywhere in the body. But then you've also got partial stiff person, which can just be considered like a stiff limb. And so the effects of stiff person on like gender, ethnicity, and race, and even possible triggers. So this disorder is twice as likely to affect females rather than males. And like I said earlier, symptoms generally appear later in life, around 50, but in the rarer cases, there are younger adults or even children that are affected with this, but that's really pretty rare. And there's no clear links between ethnicity and race and this disease occurrence. There are a few case studies that report symptoms that first appear following a significant or psychological stressor, but there's no statistic kind of significant correlation and connection between the two of those. And another case report found that first symptoms emerged following the West Nile virus, but exact etiology is still not really known. And now, kind of going into treatments, since this is an autoimmune disease, there's no exact cure for the disease. So, what we really try to do is just maintain or manage symptoms. And one way we do that is through medication. And so, we can use sedatives and muscle relaxants. And these guys will just reduce muscle spasms and rigidness via enhancing their GABA function, and that includes examples of like gabapentin and Valium. And then we can also use steroids, and these can help reduce stiffness and inflammation. And examples of steroids are like any kind of corticosteroid like prednisone. Another kind of medication that is often used are these rituximab infusions. And rituximab is monoclonal antibodies, and these guys are just man-made antibodies that are given intravenously, and they will bind to the patient's B cells and basically mark them for destruction. And this will suppress the immune system because it just gets rid of your B cells, and your B cells are the ones that kind of recognize and initiate first steps of immune response. And studies have shown that this is really just a good maintenance drug for the short term. Long-term effects have not been well researched yet, just because any kind of research with treatment options there hasn't been much research into them just because of how rare this disease is. But specifically for rituximab, there have seen improvements in gait and just overall movement for patients. And another kind of medication is intravenous immunoglobulin therapy. So this is basically just dosing your patient with antibodies. But unlike rituximab, these guys don't specifically mark B cells for destruction. It's just kind of flooding the system with antibodies. And this is the most common type of immunotherapy for stiff person syndrome. And in a rather large study of 36 patients over 2 to 3 years, it showed effectiveness also in short-term maintenance, similar to rituximab. And then, yeah, like rituximab, no long-term effects have been studied just because of how rare this disease is. But immunoglobulin therapy has shown potential to help patients respond and manage their symptoms better if they don't respond to other medications. And something that is not medicine that we can use to help manage symptoms for a stiff person is just being active. And so physical therapy and rehab is often prescribed by providers. And so any kind of exercise, stretching, and other therapeutic modalities like heat modalities, including just like moist hot packs or ultrasound, have been shown to relieve and lessen symptoms. So that means decrease rigidity and stiffness of the muscles, and then also decrease muscle spasms and muscle pain. And in multiple studies, patients that consistently did PT and rehab over 3 months, they showed signs of increased walking gait, better posture, balance, coordination, flexibility, and range of motion. So PT is kind of one of the ways that we best help with the physical ailments of stiff person syndrome, just because like medicine doesn't really help with posture, but PT, exercise can all help with posture, balance, and kind of keeping those muscles loose so that our patients can have better mobility. And there we go.